Hello, my name is Karl Nadolsky, a clinical endocrinologist and obesity specialist. On behalf of my fellow authors, I'm pleased to present our poster entitled Perspectives from Primary Care Providers and Patients on the Role of Primary Care in the NASH Patient Journey. Non-alcoholic fatty liver disease, or NAFLD, is an adiposity-based disease in which excess fat is stored in the liver. Non-alcoholic steatohepatitis, or NASH, is the more severe form of NAFLD with inflammation, hepatocyte injury, and risk of fibrotic disease progression. NASH is soon expected to be the leading cause of liver transplant in the United States. Patients with NASH can be asymptomatic or have nonspecific symptoms, making them difficult to identify. There are currently no FDA-approved pharmacological treatments for NASH, so treating obesity and associated comorbidities is important for improving patient outcomes. We wanted to better understand the role of primary care physicians, or PCPs, in the diagnosis and treatment of NASH. Therefore, we conducted a cross-sectional online survey in the United States among healthcare providers who treat patients with NASH. Here, we focus on 101 PCPs and 152 patients with NASH. In the most common patient journey, 7 in 10 patients discuss symptoms with a PCP. However, only 2 in 10 patients surveyed were diagnosed with NASH by a PCP. PCPs reported initiating treatment for 51% of the patients with NASH, while referring 34% to other healthcare providers. Only half of PCPs were aware of guidelines for the diagnosis and treatment of NASH. PCPs were most likely to recommend lifestyle changes focused on exercise or physical activity and diet or nutritional therapy for treatment of NASH. Patients also reported that they were most commonly using lifestyle changes to manage the NASH. Bariatric surgery and weight loss medications were infrequently used by patients with NASH. PCPs said that the primary reasons patients discontinue NASH treatment were the asymptomatic nature of the condition, difficulty with lifestyle change compliance, and/or just an unwillingness to make lifestyle changes. As the primary medical touchpoint for patients with NASH, PCPs can influence early intervention. PCPs may benefit from greater awareness of published guidance for the diagnosis and management of NASH, and should consider proactive discussion about the risks of NASH with at-risk patients, regardless of symptom presence, while coordinating multidisciplinary treatment if indicated. Thank you very much.